Good afternoon, everyone, and welcome to today's important webinar, an overview of the National General Practice Accreditation Scheme. We thank you for joining us in your lunchtime today for this valuable session, and we hope you take away some expert tips to support you, your staff, and your practice through the much-loved accreditation process. My name is Julie Allardyce. I'm a facilitator in the General Practice team here at Eastern Melbourne PHN. I would like to acknowledge the traditional custodians, the Wurundjeri people and other people of the Kulin Nations whose unceded lands I am working on today, and thank them for their care of the land and waterways over many thousand years. We also acknowledge the traditional custodians of country throughout Australia and their cultural, environmental and spiritual connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Well, we are very fortunate today to have three knowledgeable guest speakers, and I would like to give them a very warm welcome. We have Samantha Smorgan, who has nearly 20 years experience in Australian general practice and is currently Acting National Manager, Policy and Advocacy and Program Manager for Standards at the RACGP. We also have Rebecca Peters. Rebecca has worked at the Australian Commission on Safety and Quality in Healthcare since 2017, and Rebecca is responsible for the coordination of the National General Practice Accreditation Scheme, supporting the consistent assessment of Australian general practices against the RACGP standards. And we also have with us today Kim Packham. Kim is the Manager of Primary Healthcare and National Standards at the Australian Commission on Safety and Quality in Healthcare, seeing her responsible for the National General Practice Accreditation Scheme and the development and implementation of the National Safety and Quality Primary Healthcare Standards. Kim's focus is to drive improvements in patient safety by working with healthcare providers and services, consumers, primary health networks and national peak bodies. Just before we begin today, I'd like to all attendees are on mute. So if you have any questions, please add them to the Q&A box at the bottom of your screen, and we will facilitate these questions with our presenters at the end of the session. Today's webinar is being recorded and all attendees will receive an email with a copy of this recording and any relevant resources. And certificates of attendance will also be issued to those who are online today as well. At the end of today's webinar, you will also receive a short survey. We'll be really grateful if you could please take a couple of minutes to answer these questions, as it's very valuable and helps us in providing ongoing education. So again, I'd like to welcome all our guest speakers and hand over to Samantha to begin our session. Thanks, Samantha.
Thanks, Julie, and hello everyone. Nice to be here and thank you very much for the invitation. I'm going to do the little bit about the RACGP and the standards for general practices and start the conversation about how that fits into the National General Practice Accreditation Scheme, because we are inextricably linked to the work of the Commission since the implementation of the scheme in 2017. So as long as my tech works. So today I'll look at what are the standards, how does the college develop them, what they include, and the role of the RACGP and how we work with the Commission, as I just mentioned. So the standards for general practices, and you'll notice this is probably a cover design that you haven't seen before. It's our new branding that's starting to come through with the most recent updates. But the standards are a benchmark for quality, safety and risk management in Australian general practices that it aims to protect patients from harm by improving the quality and safety of health services. The standards are intended to support practices to identify and address gaps in any systems and processes for the work that they undertake in caring for their patients. And the current edition of the standards was launched in 2017. As some of you might be aware, there's been a series of updates over the last couple of years. We did one in response to the COVID-19 pandemic in 2021, and there was some changes to mandatory requirements of the unflagged indicators that came through at the beginning of this year. So if you need more information about them, very happy to supply it and provide it. So the way we develop the standards is actually through the RACGP Expert Committee, Standards for General Practices, and that's a subcommittee of the board. There are 6 of them across the college, and we have one of them for standards, and it consists of 8 GP members, and we also have 3 representatives, one from the Australian Association of Practice Managers, the Australian Primary Healthcare Nurses Association, as well as a consumer representative from Consumers Health Forum. And there are also 3 senior project officers that work within the college's standards team, and they're the ones that do all the evidence base and foundational work that supports the work of the committee in developing standards. We develop standards through a modified Delphi, which is a series of testing and reviewing and refining and consulting. So we went through 3 cycles of a modified Delphi through the development of the 5th edition. And I will talk about this a little bit later, but we're starting our journey onto the 6th edition, and we will be using a similar approach where we're constantly testing, reviewing and piloting. The process includes targeted stakeholder workshops throughout Australia, and we are starting to get that planning underway for the 6th edition now. In the 5th edition, we did 3 rounds of public consultation, and we anticipate the same. We also did 3 rounds of testing and piloting. Not all of them were full pilots. We did a preliminary pre-test pilot, which was just a handful of practices, then the massive pilot, which had over 350 practices, and then the final hotspot review. So any of the sticking points that we weren't able to rectify through those couple of processes, we target them on final review with an update and a change, just to make sure that it was fit for purpose. And we look at it from a feasibility perspective, acceptability, is it what is considered appropriate for the setting? We also seek medico-legal advice, so looking at what the potential implications might be for some of the standards that we require of practices, obviously the evidence base and anything new and emerging that has come out. And I guess the digital age has enabled us to be a lot more responsive to emerging evidence, and COVID-19 and updating the standards in 2021 is a great example of that. But we have also received feedback from the profession that the rolling edition is quite hard for them to keep on top of, and so we will take that on board and think about that as we go into developing the next edition. We also look at comparable local and international standards. We've got the Commission team here today, and the National Primary Care Standards that they have developed will be part of our consideration when we go towards the 6th edition. We certainly don't want to duplicate. The standards for general practices are profession-led and appropriate for this setting, but we want to make sure that there's not too much of a discrepancy, particularly as we work towards multidisciplinary care coordination, and there's going to be lots of quality and safety frameworks that sit around that intersect with other comparable local standards, and then of course anything that's happening in the international sector and understanding what it looks like worldwide. Then our standards are actually accredited, so we apply the same thing to ourselves as we do to practices, which is we put ourselves through an accreditation process with the International Society for Quality and Safety in Healthcare, and that's a 5-year accreditation, and so we need to make sure that ours are assessed as being completely appropriate compared to the international best practice and evidence. And then at the final stage, we run it through our editorial and publications team to make sure that everybody can understand what it is that we're trying to say through a plain language review. This slide's just a bit of a visual on the process. So, initiating, so this is where we are now on the 6th edition, going into round 1 after the standards team have done the evaluation and sought feedback, looked at the evidence, developed drafts, and then we move it through each of those rounds of the modified Delphi as I explained a little bit earlier. All of our external documents also receive board endorsement as well prior to release. So the standards include a whole lot of different information. I've just put this up here because there was a significant shift from the previous edition, which some of you might be familiar with, of the 4th edition standards, which was divided into sections with titles. And in the 5th edition, we went into the modular structure with a core module, a quality improvement module, which is what the college considers to be the best practice baseline for all primary healthcare services, and then the GP module, which clicks in. And the reason that I draw attention to that is because some of you might be aware we've recently updated the immigration detention facility standards, and we're about to update the prison standards as well. So in the modular format, those other settings would click out from the GP module and click into the other settings for primary healthcare service delivery. This potentially could change into the next edition. So within the modules, you can see here, you've got sort of those baseline communicating with patients, information about the practice, the sorts of health promotion and preventative activities that practices can undertake, how clinical management and clinical governance occurs, management of information, including information security, the content of best practice for patient health records, and education and training requirements for non-clinical staff. The quality improvement module is a little bit smaller, but there are a lot of efforts in there, particularly quality improvement and patient feedback. So these are the items that look at the CQI, so the different components of your practice systems that you need to monitor over time, and the efforts that are never completed, that you're constantly needing to look at data quality, clinical indicators, and obviously risk management. And then the general practice module, which sort of goes more into access to care, what comprehensive care looks like and requires in a system, the qualifications of the clinical team, reducing and managing infection, including sterilisation or reprocessing, the medical practice and what's required within the general practice from an equipment point of view, and also cold chain management, vaccine potency. The biggest changes that we made to the standards from the previous editions were the outcomes focused and patient centered language that we changed it to. I've given you a couple of examples down below in 2 separate tables. I'm not sure how busy that slide, that slide is for you. But it was very much, all previous editions before the current were very much process driven. The standards sometimes even indicated the kind of evidence that needed to be provided for practices to meet the requirements, and we found that was very prescriptive. And so the outcomes focused shift was so that practices had more flexibility and could actually demonstrate compliance to an indicator based on the systems and processes they use. And the reason we did that was we know anecdotally that there's a lot of policy and procedure manuals that are developed for accreditation, and they don't necessarily reflect the day-to-day practice within the setting itself. And so we wanted to make sure that practices could actually demonstrate their components of compliance based on the systems that they use, rather than having to meet the requirements that were prescribed by the standards. So you can see there in those examples, it's a position description to describe their role, and the outcomes focus is they know what their job entails, and so they know what their role in the team is. The other one example is about a process for seeking and responding to feedback and the ways in which it needs to be done, and the outcomes focused shift was just it's regularly sought from patients and that the practice responds to it. Patient-centred as well, we're very much looking at systems of quality and safety to ensure that the patient outcomes are positive and avoiding adverse events or near misses. And so shifting it to the focus being on patients, it's about the service that the patient receives and experiences rather than what the practice is doing. And so you can see the examples of the shift there for practices aware of the arrangements that are in place for after hours care, and it's the intention of the indicator is for the patient to be able to access after hours care, and you can see that shift in the language there. So therefore, as I've said, you can choose a number of different ways on how you meet the indicators, and I'll go through the layout of each criteria shortly, but there are some could options underneath all of the indicator requirements that can give you some more lateral thinking rather than just meeting the prescribed outcome, to think about it, how you actually do it and how you can demonstrate that for your accreditation process. The indicators have also been simplified, and unfortunately there are a few exceptions for the outcomes focused indicators, because high risk and regulation requirements such as cold chain management or infection prevention and control remains prescriptive, because there is a best practice way to do it. It can't be just outcomes, whatever you want. There are guidelines to follow that are based in best practice evidence. So within each of the indicators, this is what I was referring to, and I can just see that that is quite fuzzy, but within the standards themselves, hopefully it'll give you some framework to go through it. But the explanatory notes are all structured in the same way. So I've given the example of the first criterion within the core module. So you can see it's got core is as the C at the front, and it's criterion 1.1. And all of the explanatory notes are broken down into why this is important, meeting this criterion, and meeting each indicator. So the explanatory materials are actually really important for you to understand what the intention of the indicator is. There has been experience where practices are simply responding to the indicator and sometimes haven't quite met the mark because there hasn't been a deeper understanding of the reasons why it's important and the intention of including that in the criteria. And then within the meeting in each indicator, there are musts statements. And so for every must statement, which only are within mandatory indicators, you must meet all of those requirements. So you must make information about your practice available to your patients and be able to demonstrate how you do that. So while they are must statements, there are various ways in which you could actually show that you have done what is required. And as mentioned just briefly before, the could statements are for inspiration to meet the musts. It gives you much more detailed ways of how you might go about providing information to your patients about your practice. And so the coulds are very much sort of helping you think about what you might be able to do to meet your obligations. And as I mentioned previously and earlier, we are in the process of starting our development of the 6th edition, and we're going to do a bigger shift. Oh, sorry. Did that again. A bigger shift from outcomes to outcomes focused and being patient centered. We believe that we got sort of 85%, 90% of the 5th edition right as far as those language changes goes, but certainly as we've learnt our lessons from implementation along the way and feedback from the sector, that we can do better and improve that ourselves. So we will be expanding on the outcomes and patient-centred, as well as obviously the same details. We're currently in an open feedback call. We have started promotions through our Standards News newsletter, asking for any general feedback that practices may have on the current 5th edition of the standards. And as we start to develop a bigger framework for the project more broadly, we will start to expand into consultation opportunities where you can actually provide us or participate in a more formalised call for feedback on the 5th edition. So the role of the RACGP is really as the author of the standards. We work with the experts, we have the expert committee, we seek feedback from our members, we consult with all of the peak bodies. So obviously we've got representation from the key other organisations that are involved in general practice management and accreditation, but we actually go broadly through their membership rather than just through our representatives. We're actually also going to be targeting particular groups within so, for example, we've got an unflagged indicator at the moment that looks at refugee or country of origin for refugees or asylum seekers, and whether or not we're actually going to ask that to be mandatory into the next edition. And so we'll be going to the Asylum Seeker Resource Centre and other peak bodies about their view of what cultural inclusion looks like and how we might improve the standards to be more representative, obviously notwithstanding the medical software vendor challenges in having that data be able to be recorded. But we are targeting our consultation and evaluation of the current edition to those peak bodies right at the front. So we will, there will be opportunities for you to be involved. We expect the process to take about 18 months. And then how we work with the Commission. So this is just a brief introduction to get ready to hand you over to the Girls in the NGPA and Primary Care Standards scheme. But to look at the general practice accreditation process in Australia, there's actually three key peak bodies that are responsible for the whole picture of accreditation in Australia. So obviously we've got the RACGP as the authors of the standards. We've got the Department of Health and Aged Care as the stewards of the practice incentive program, and also looking at putting the regulatory framework in for quality and safety, and then the Australian Commission for Safety and Quality in Healthcare, who are the governance and oversight of the whole system of accreditation in Australia. So we work very closely with the RACGP works very closely with those two other organisations to ensure the development and implementation of the standards and accreditation is consistent, fit for purpose, and well coordinated. So that's me. So to hand over to the team at the Commission.
Thanks, Sam. We're just going to share our screen. This is a great segue and introduction. Thank you.
Does that come up?
We're just seeing a black screen at the
moment. Not yet.
Oh, there we go. Yep, perfect. Whoop. Okay, so we'll start at this one. So hi everyone, and thanks Sam for that introduction, and for Julie and Kathy for hosting us and having us here today. So my name's Kim Packham, and I'm the Manager of Primary Healthcare National Standards, as mentioned, and I'm joined by my colleague Rebecca Peters. So for this part of the session, we're going to cover a range of things. So broadly, a little bit about the Commission for those of you that aren't familiar with us as a government agency. We're going to spend quite a bit of time walking you through the accreditation assessment process and, you know, the key timeframes to sort of look at. And then we'll finish off with some hints and tips and where to go for more information, and happy to take questions at the end. So on to the next slide. Thanks, Beck. So a little bit about the Commission. We're a government agency and our role is to lead and coordinate national improvements in safety and quality in healthcare. So we are established under the National Health Reform Act. And we're jointly funded by both the Australian Government Department of Health, the Commonwealth, as well as state and territory governments. And we are reportable to Minister Butler, our Health Minister. On to the next slide. So I've pulled out some of our roles and functions directly out of the National Health Reform Act, but in our role in administering the National General Practice Accreditation Scheme, that really relates to the function that we've highlighted there with the red arrow around formulating national accreditation schemes for health services that relate to safety and quality matters. So that's our mandate, I suppose. And we're very much a safety and quality improvement body, and our functions do reflect that. Next Next slide, thanks, Beck. So obviously you all know what accreditation is about, but I just wanted to sort of spend a couple of seconds, looking at the bigger picture. And when we talk about accreditation, just a little reminder that we're talking about an independent review process of a health service, in this case, general practice, of evidence of implementation against specified standards. So the specified standards we're talking about in this context are the RACGP standards for general practices. And Sam has already, walked you through why they're important and, what they sort of cover. And through the independent verification of the evidence that, a service or a general practice has implemented those standards, this provides confidence in the community, in government, in stakeholders that these services are safe and they meet expected standards for safety and quality. So that's why we're here, and that's sort of the motivation behind accreditation, broadly speaking. When we talk about the National General Practice Accreditation Scheme, next slide, thanks, Beck. And I've just noticed this little typo in there. We're missing an S there. So we've spoken about accreditation, but in the context of the National General Practice Accreditation Scheme, the Commission is here to support general practice, become accredited to the RACGP standards that Sam has taught you through, and also the standards for point of care testing. So the role of the Commission in this space is to provide national consistency across the assessment process. And so this provides for, the independent verification process to occur. It also ensures that the same rules are applied across the board, so no general practice is being treated, in a different way to another general practice across the country. There are a range of accrediting agencies available, so we want to ensure that there is a level playing field across the board, and I'll talk more about accrediting agencies in a bit more detail. Obviously, accreditation is voluntary, but the vast majority of general practices in Australia are accredited to the RACGP standards, and that's a great thing. It's also a requirement for access to government incentives such as the PIP program, which I'm sure you're all familiar with, and also the WIP program, so the Workforce Incentive Program. So Sam touched on this with a different diagram, and she created her own, but I've pinched one from an independent review conducted into general practice accreditation back in 2021. And this, very succinctly describes the different roles and responsibilities of all the players in this accreditation scheme. So the department obviously oversees funding for the scheme and the requirements for the practice incentive payments and the like. You obviously know a lot about the RACGP and their role in developing the standards. Obviously, we have the accrediting agencies that conduct the assessments, and yourselves as practices who implement the standards and choose to participate in the accreditation process. So the Commission's role in this whole ecosystem, I suppose, is really around formulating and administering the governance arrangements, so the rules, policies, processes around the NGPA scheme in line with international best practice, but also in consultation with stakeholders such as the RACGP, but also ACREM, APNA, AAPM, consumers, the department, and PHNs as well. So we consult with the sector broadly in terms of setting the rules for this scheme, and we have a coordinating committee that meets regularly to support that process. So we're not working independently, we're making informed decisions. We also approve and provide oversight of accrediting agencies that go in to conduct the assessments in general practice. So that ensure, sorry, Beck, I haven't finished with that slide, thank you. To ensure consistent and high quality assessments in the accreditation process. We also review and make decisions on individual submissions made by general practices. So if some of you have come into contact with the Commission, you may have been submitting a request for an extension to your accreditation certificate, or during COVID, perhaps making a submission around having your assessment conducted in hybrid form, or an appeal to a decision that your accrediting agency's made. We also assess and address complaints general practices may have against their nominated accrediting agency, and we also evaluate any related data relating to the scheme to have a look at trends and opportunities for improvement. Next slide, thanks, Beck. So as I mentioned on the previous slide, one of the Commission's functions is to approve and oversee the accrediting agencies in this process. This occurs via an application process that happens every 3 to 5 years. So in assessing the suitability of accrediting agencies to conduct, bit of flickering there, to conduct assessments, we have a look at the submissions, and we consider whether that accrediting agency is a fit and proper organisation, whether they maintain their own independent accreditation against a recognised body such as ISQA, which Sam mentioned, or JASANTS. They're committed to adhering to the rules of the scheme as defined by the Commission in consultation with stakeholders. You know, that their workforce and assessors have the appropriate skills, qualification, experience in general practice to conduct assessments. So those are the sorts of things that we look at in making a determination about whether an accrediting agency can assess against the RACGP standards under this scheme. And accrediting agencies that are approved to conduct those assessments are required to adhere to the rules. So we ask that they're committed to adhering to them, so we check that they do. They are required to submit data on a range of things such as, you know, the number of assessors, what type of training is being conducted, assessment outcomes, all that sort of stuff. They're also required to attend regular meetings with the Commission so that they can stay up to date with what's happening across the scheme and contribute to the overall, you know, operation of the scheme. And they're also required to maintain the currency of knowledge and practice of their assessor workforce through, you know, delivering regular training and that sort of thing. The other thing that we do is we conduct observation visits of assessors. So if you happen to be having an accreditation assessment and you see myself or Beck, we're not there to assess the practice, we're actually there to have a look at the assessors and how they perform. All of this feeds into an ongoing performance management process with the accrediting agency. And that's how we sort of ensure that, you know, they're behaving as they should and all is well, and there's, you know, areas for improvement are addressed in a timely manner. So next slide, thanks, Beck. So I am now going to hand over to Beck, who is going to walk you through the assessment process, and then we'll come back and talk about some hints and tips and where to go for information. Thanks, Beck.
Thank you, Kim. So as Kim just mentioned, I'm going to walk you through the overview of the assessment process. So general practices should commence coordination of the assessment processes 12 to 18 months from their accreditation expiry date. An accreditation cycle is generally 3 years, with an assessment occurring before the end of each 3-year cycle. So once the general practice has entered a contractual arrangement with an accrediting agency of their choice, the assessment process will involve the following. So an initial assessment, which can be up to a two-day on-site assessment of the general practice. The remediation period, this is where the general practice is given a set amount of time to implement changes to demonstrate that they have met the requirements of the specified indicators. The final assessment, this is where the accrediting agency will determine if not met indicators have been remediated. And finally, determination of accreditation. An accreditation certificate is issued to general practices that have met all the relevant requirements of the standards. So at the initial assessment, the accrediting agency will undertake an on-site assessment of a general practice at least 4 months and no more than 8 months prior to the accreditation expiry date. If the general practice, for some reason, requires an assessment to take place earlier, an approval from the Commission is required. The accrediting agency will review evidence provided by the general practice to demonstrate that they have implemented relevant indicators. And at the end of the initial assessment, the accrediting agency will provide an initial report to the general practice 5 business days after the on-site assessment has occurred. And inside that report, it will advise the general practice of any indicators rated not met. So let's look at the rating scale for the assessment. At this assessment, the accrediting agency will use this rating scale to determine to what extent the practice has met the indicator. So at the time a general practice is assessed against the RACGP standards, assessors will assess evidence of compliance to relevant indicators and assign a rating. So there are 4 ratings. The first one is met, which means all requirements of that indicator are fully met. Not met, which means part or all of the requirements of the indicator have not been met. Then there's not applicable, which means the indicator is not relevant to the general practice being assessed. And finally, not assessed. That means the indicator is not part of the current assessment process and therefore it's not reviewed. The remediation period is where relevant indicators assessed have been rated not met. The general practice will be given 65 days to implement changes to demonstrate that they have met the requirements of the specified indicators. Obviously, a general practice can close these off sooner, and generally the sooner the better to ensure the general practice is awarded accreditation before their accreditation expires. The accrediting agency will conduct a final assessment to determine if indicators rated not met have been remediated. Accrediting agencies then have 20 business days to provide the general practice with a final report and to determine if accreditation is awarded. Accreditation certificates are issued to general practices that have met all the relevant requirements of the standards. Accreditation is awarded for 3 years. If the requirements are not met, accreditation is not awarded. So general practices may reapply to be accredited with an accrediting agency of their choice. Services Australia may withhold payments for the Practice Incentive Program, PIP, and Workforce Incentive Program, WIP, if accreditation has expired. So for more information about PIP or WIP programs, please contact Services Australia. I am now going to walk you through some other elements of the scheme. These are some of the most common ones, but please note there are others which are on our website which you may like to familiarise yourselves with. So if a general practice does not agree with their assessment outcome, an appeal may be submitted to the general practices accrediting agency or directly to the Commission. It is recommended that the general practice exhaust all avenues of review or appeal with their accrediting agency before submitting an appeal to the Commission. The Commission will only consider appeals where there is evidence that the relevant accrediting agency did not comply with Commission specified policies, processes, or directions relating to the assessment conducted. An appeal, whether made to the accrediting agency or directly to the Commission, must be submitted within 20 business days of the general practice receiving its final assessment report from its accrediting agency. On receipt of appeal, the Commission will seek information from the relevant accrediting agency and review the evidence provided by the general practice and the accrediting agency. The Commission will then establish a panel to review the appeal and make recommendations to the Commission's Chief Operating Officer. The Commission will come back to the general practice within 10 business days of the panel being convened with the Commission and will notify in writing the general practice and the accrediting agency the outcome of the appeal. And please note, once the Commission has issued a determination, there is no further avenue of appeal within the Commission. The next important element of the scheme is extensions. So an extension to the accreditation expiry can only be granted by the Commission, and the Commission will only grant an extension where there are extenuating circumstances, which are limited to natural disasters and other emergencies, and significant personal hardship or tragedy that directly affects the governance of the general practice. The Commission recommends that general practices liaise with their accrediting agency prior to submitting a request, and the Commission will contact the accrediting agency for information as part of its assessment of the submission prior to making a determination. And please allow at least 10 business days for the Commission to make a determination, and you can find more information on our website under Advisory GP 1801 Extensions to Accreditation. The next important element is relocations. So the relocation of any health service creates additional safety and quality risks for patients. Therefore, general practices that plan to relocate are required to notify their accrediting agency as soon as practical, and the agency will work with them during the transition to ensure a relocation assessment is completed. So this assessment is required to ensure the safety and quality processes remain in place as other premises become operational and that the practice continues to comply with the RACGP standards. General practices that intend to relocate are also required to notify Services Australia of the move and provide them with an accreditation certificate that includes a new address following the relocation assessment. And the final element I'm going to speak about today is the transferring between accrediting agencies. General practices now have a greater choice when seeking accreditation services, and they may choose to change their accrediting agency at the end of the contracted period or during their accreditation cycle. Accrediting agencies are required to maintain a general practice's existing accreditation cycle, which means the timing of the general practice's next assessment should remain unchanged. Further information on transferring between accrediting agencies is available in Advisory GP 1802 on the Commission's website. I'm now going to pass back to Kim to provide some final hints and tips and where to go for more information.
Thanks, Beck. So Beck's given you a very comprehensive overview of different elements of the scheme, and all that information is available on our website. So I'd like to spend a couple of minutes just focusing on some hints and tips for your upcoming assessments. So as I mentioned, all the information is available on the website that Beck's just gone through. You can also access the contact details of all the accrediting agencies approved to conduct assessments under the scheme, and also the contact details for the Commission's Safety and Quality Advice Centre that you can contact for advice and support relating to accreditation. You can also go to the RACGP, Sam's team, or your local PHN who are hosting us today for implementation support. On to the next slide, thank you. Second sort of hints and tips here are really to start scheduling early and preparation early. So you would have seen from Beck's slide, if you add up all the elements of the assessment process, that in itself can take up to 5 months to complete from the date of your initial assessment. So if you've gone through accreditation before, you know there's quite a bit that goes on before the day that the assessor rocks up to your practice. And planning for that assessment can take a bit of time in working out the best date. Some accrediting agencies also require that you complete a self-assessment process before scheduling your assessment, or in the process of scheduling your assessment, which is a good thing. You know, that helps you to prepare for your assessment, but it all takes time. So if you have an expiry date of 12 to 18 months away, that's not too early to start. Have a look at what you need to do, have a look at the rules, think about, you know, the movements of the people in your practice, all that sort of stuff, and work that into your planning process and have that conversation with your accrediting agency early. And obviously there are a number of accrediting agencies available as well. So understanding the assessment process and the timelines to minimise risks of gaps in accreditation, well, hopefully you're better informed after today's session about what that process is and where to go for more information. And hopefully you also know where to go for help and assistance with implementation as well after Sam's presentation. The other thing I would say is that once you've gone through the trouble of preparing for accreditation, is to do your best to use what you've implemented day to day. So really embedding it into your everyday business as usual, you know, ongoing work. That way you're regularly using all the things that you've set up to prepare for accreditation, and that's really going to support quality improvement. And when it comes to preparing for your next cycle of assessment, it's not a case of dusting off the cobwebs to see what someone wrote a few years ago. It's actually being used day to day, so it should be a very organic and ongoing process. Next slide. Thanks, Beck. The other thing to do, we would suggest, is to have a look at the Commission's Lesson Learnt webpage, and there's a link there. And this is really provides a summary of aggregated assessment outcomes that you can learn from. So for example, we know that based on the assessment outcomes of general practices that have gone through an assessment, is that the most commonly rated not met indicator at the first assessment that requires remediation is GP 3.1A around the qualifications and certification of the clinical team. Now, obviously, we know that in the vast majority of cases, your general practice practitioners and nurses are qualified, but we understand from feedback from accrediting agencies and general practices it's the documentation aspect of it. So, you know, if you know this is an area that a lot of general practices appear to struggle with at the initial assessment, and that's something to really take a close look at. look at the must and coulds in the detailed explanatory notes of the RACGP standards, and make sure you're really addressing those in details, and then you won't fall into the similar sort of trap that others have. So there's a bit of information there on the lessons learned page, which is worth having a quick look at in your own preparation. Next slide. And then finally, know when to contact the Commission. So look, usually most of your interactions will be with your nominated accrediting agency, but there are times when you should contact us directly. So one of those is to provide feedback on your accrediting agency after an assessment. We do send out a post-assessment survey after you've completed an assessment. Please be reassured that this is really about the accrediting agency, and we're seeking your feedback on the accrediting agency themselves rather than your performance at the assessment, and it can't impact your outcome of your assessment. So we do encourage you to fill out this feedback when it comes your way, because that does help us improve, you know, the overall operation of the scheme. You may need to contact us if you need to submit a request for extension, or this can also be done by an accrediting agency, or appeal a decision of the accrediting agency. So there are instances where you might want to contact us directly. And any questions relating to accreditation and assessments, feel free to contact us directly to seek advice. We have a Safety and Quality Advice Centre with a telephone line and an email, and we try to get back to people, if not over the phone immediately, then, you know, with 2 to 3 days. So we are available to hear about your individual circumstances and offer advice from that perspective. And that comes to the conclusion of our part of the presentation, and that's the details of the Safety and Quality Advice Centre there. So we'll hand back to Julie.
Thank you, ladies. That was great. And I can't see any questions in the chat box, in the Q&A box. Can anybody else see any questions? No. Okay. I had a question which I did speak with lovely Rebecca about the other day, and with grants money being provided now for accreditation, we've had questions about employing a consultant to come into the practice for accreditation, and just want to know the rules around that and on the actual survey visit day, who is allowed in the accreditation visit if you've employed a consultant.
So I'm happy to take that one. The Commission has recently, or I think we have recently, published some more detailed guidance around the role of consultants. We certainly understand that general practices may require consultants to support them through the preparation process, but consultants who are not really part of the day-to-day operations it's not really appropriate for them to be at the assessment themselves, because it really needs to be about people who are working in the practice understanding and knowing their systems, rather having someone who's helped you set it up answer all the questions, so to speak. So from that point of view, I think that's what our updated guidance has clarified, because we did have a couple of questions from some accrediting agencies. Sam, did you have a view or anything to add on that one?
No, you covered it well, Kim. I think if they're not a member of the practice team, then it's absolutely not appropriate on assessment day. It's about systems and processes that the practice actually implements themselves, not by a third party. But the only other thing I would say as well is that, and I think the Commission has something on this as well, is that if you've used a consultant, then they cannot be your assessor. So it might be that a consultant works for one of the agencies and they would need to claim Barleys on being available to assess a practice that they've actually helped prepare for accreditation. And I can see nods from Kim and Beck.
Yeah, and that's one of the things that sort of takes up the time in the scheduling process. So when accrediting agencies assign an assessor, they need to check that the assessor has not worked or been involved with that practice. So there's a bit of time there, which is why we sort of keep saying, get your schedule in early so that they can work all that out.
Thank you. That's great. Still no more questions, so I guess I'd like to say thank you for putting on such a great presentation today for everyone that was online, and I'm sure those that will access the link that couldn't make it today. And anyone who is still online, at the end of the Zoom, you'll get a survey. So we'd be really grateful if you could fill it in about the presentation today and any ongoing education you might require. So thank you all. It's great. Thank you very much. Bye.